Hi, my name's Tyler Aasen. I'm a fourth-year medical student at Des Moines University, here to talk to you about some research. And first of all, I'd like to thank Cynthia Hoque, Catherine Nelson, Christa McEnerney, and Dr. Josh Stubblefield over at Broadlawns for helping put this project together. Specifically, we wanted to focus on patients over the age of 65 at Broadlawns, and we wanted to look at methods to increase their immunization rates, specifically for Zostavax, pneumococcal vaccine, and tetanus vaccines. So what we did initially is we audited the charts of all the patients over 65 at the Broadlawns Family Health Center, took down who was immunized, who was not, and we cross-referenced that information with IRIS, which is the Iowa Immunization Registry, to pick up those who didn't get vaccinated at Broadlawns and make sure we had that data. Once we had this data, we identified people who were missing certain vaccines and sent them a letter. This letter basically detailed what vaccines each individual patient was missing and why it's important to get that vaccine. Once we sent that letter out, 6 months later, we again went in the charts and went into IRIS and looked at our progress. And at that time, we did get statistically significant data in terms of vaccination rate improvements. 1 year later, after we sent the first letter, we again audited the IRIS charts and sent out another letter. This letter was very similar to the first one, identifying patients missing those particular vaccines and telling them to come to the clinic, make an appointment, and get them. And what we found, I'll show you this graph here, is initially Broadlawns vaccination rates in terms of Pneumovax were 31%, and you can see all the other percentiles. After we sent the first letter, we were able to increase our Pneumovax vaccination rates to 38%. After the second letter, again, another statistically significant increase to 50%, and kind of the same thing for each of the other vaccines. If we look at this second graph down here, what we found was initially, this pink line here is the national average in terms of vaccination rates. This purple bar here is what what the rates at Broadlawns were 2 years ago. So clearly well below the national average in terms of vaccination rates at Broadlawns. After 2 years and 2 letters, as well as great effort by the residency program there, we were able to get this 31% up to 50% for Pneumovax, which for Pneumovax still below the national average, but certainly a step in the right direction. For Zostavax down here, Broadlawns has actually exceeded the national average in terms of vaccination rates, which we're quite proud of. And again, tetanus, we doubled our tetanus immunization rate, still below the national average, but again, a step in the right direction. I think this project is important because, particularly in a community hospital like Broadlawns with a difficult patient population, we definitely are very interested in increasing the vaccination rates in order to prevent vaccine-preventable illness. So I think that this letter intervention certainly did help take a step in the right direction. We're looking into investigating whether emails, text messages, phone calls, that type of stuff is also equally effective, but this particular project looked at letters, and we were pretty pleased with our results. Thanks for having me, and we'll see you later.